Welcome to Your Health Matters. I'm your host, Temesia, and tonight we have a special guest from Sai Prema Foundation, and I'm so excited that she could make it. If we can please welcome Dr. Krupali. How are you tonight?
Very well.
Thank you so much for making the time to come. I've been so excited and fascinated with the Sai Prema Foundation. If you could just really open up and share about your role with the foundation, and I know you have a hospital as well. I don't want to confuse the two, so if you could start with the Sai Prema
Sure.
Foundation.
So I'll start with the foundation. So
Mm.
Sai Prema Foundation is a non-government organization. It was registered in 2016,
Wow.
and we're registered under
You're
the
almost 10 years old.
yes,
Wow.
and we're registered under the Charitable Trusts Act.
Yeah.
And really, the vision was that we wanted to help the people of Fiji,
Yeah.
the underprivileged and more needy people of Fiji in the areas of, healthcare,
Yeah.
education, nutrition,
Yeah.
all of that. So it was very few people. We had a small group of people
Really?
initially thinking we want to do some good out there.
Yeah.
And I'll be honest, it has grown.
It has really grown.
A lot has happened
Mm.
since we started in 2016. A lot of initiatives, a lot of projects that have
Yes.
happened through the foundation. If you want me to sort of expand a little,
Oh, yeah,
I'm happy
please,
to
yeah.
do so. So in
That'd be
terms,
amazing to hear.
yeah. So initially we started off with our Health on Wheels
Yeah,
project.
that one was one of my favorites that I think
Yes.
that was really the, whoa, what's going on
Yes.
here? Is this a hospital on a bus?
Yes.
Please share about it.
So we had there's a big truck, the Health
Yeah.
on Wheels truck. We, as a foundation, we
Yeah.
worked with a lot of different people, volunteers, medical and non-medical.
Yeah.
We involved
You did bring in quite a few doctors too
We
from
did.
overseas, I saw,
Yes,
yes.
we did. So we had GPs,
Mm.
some specialist doctors from CWM. We
Wow.
had pharmacists. We
Yeah.
had the women's wellness team
Yeah.
doing pap smears.
Oh, wow.
So cervical cancer
Yeah.
screening. We were doing some heart screening. We also had physios, pharmacists, dental. So we were
Wow.
providing, basically taking health to the villages,
Yeah.
to the rural communities. And it
Mm.
started because of after Cyclone Winston, there was a need.
Right.
And so we were looking at the Tailevu region.
Yes.
And we thought that we would help out, the communities there. So we did over 6,500 consultations in total.
Wow.
We also dispensed free medication. So that was really a great start.
Yeah.
And we realized that in our communities, there's a lot of people who have undiagnosed diabetes, hypertension,
Yeah.
heart disease, and even dental issues.
Yes.
And it was fantastic to see that people were taking advantage and
Of
they were
these services,
benefiting from the
Mm.
services because sometimes they can't even go take a bus or have bus fare to go to the health center. Right?
So,
it was,
coming to them accessible.
yes.
Yeah.
So that was fantastic. We started like that. And then we also had a visiting team. So in 2016, in August,
Yeah.
we had our first visiting team that did children's heart surgeries.
Wow.
At that time, of course, we didn't have the hospital, and we'll come to that later.
Yes. I really want to know about this
Yes.
hospital.
But we did that at the CWM hospital. So
Wow.
we put a team together. So Sanjeevani hospitals in India had already opened, and the chairman was here the year before, and he said, look, we're happy to help you if you need help. And congenital heart disease is an issue, children who are born with heart defects.
Here
And
in Fiji?
Yeah, in Fiji, in the
Wow.
Pacific.
Yeah.
So we put a team together, some doctors and nurses from India, Australia, Oman, and we did the first lot of surgeries at CWM. So that was
Wow.
2016. And then again in 2018, we did these surgeries. And by then we realized that there was really a need. There were a lot of children out there in
Yeah.
the community who have these defects, with heart issues, and sometimes they present very late or there's really late detection. So we thought there was a need, to do more,
To do more.
and that we needed a facility.
Yeah.
So in 2018, the foundation, we opened our Sanjeevani Medical Center, which is
Yes.
in Nasese.
Yeah.
We as a foundation built and equipped it.
Wow.
The government had granted the land on which it
Yes.
sits, and we have an MOU with the Ministry of Health. They help us with staffing and medications, basic consumables.
Wow.
So we did that. And then a year later, 2019, we realized there was a real need to screen, detect,
Wow.
these defects in children early.
Yeah.
So we opened a children's heart screening center in April 2019. We had a couple from New Zealand who donated a very good machine.
Really?
Yeah, and that's
There's
how
a lot of great people in the world
Yes,
that are
yes.
looking to help. Eh?
Yes.
That's amazing.
Yeah. So
Now that we're at the hospital, which is one of my favorite sites to see when we go through Nasise because of the big how did that design even come to? Because it's such a great way to just kind of throw it out there, like, come check your heart, children.
Yes. So I think that big iconic heart,
Yeah.
it symbolizes the work that happens in the
It
hospital.
does, you're right.
We help children who have heart defects. So we do
Yeah.
free surgeries for children with
Yeah.
congenital heart disease, and some
Yeah.
children who have valve issues through rheumatic heart disease. We've
Yes.
helped them as well with their valve repairs.
Yes.
And really, the way the design came about was that some of the other Sanjeevani hospitals in India, similar
Yes.
hospitals, the building is in the shape of a heart.
Oh, is it?
It
Oh,
is,
okay,
it
good to
is.
know. Next time when I'm in India, I better look
Yeah.
out for this.
But, it's not easy to build a building in that shape.
No.
Construction is very difficult.
Yeah.
So we thought we had to have a heart
Somewhere, somehow.
somewhere. And so, we were working with a few people,
Yeah.
the engineers, one of the surgeons was from India. He said, oh, maybe you can have a heart, something, sort of
Somewhere
projecting
there,
this
yeah.
way. And we had a few of our key members work
Yeah.
together, and
They
we
came
have
up
this
with
big
that
red
concept.
heart.
Wow. Dr. Krupali, what was it like for you setting this up with your amazing team and the members that you've mentioned? Was this something that was always down the line for you in your career path, or your heart for people? Like, I just find that so beautiful.
Thank you, Temesia. Well, to be honest, I actually, so I did my medical degree here
Yeah.
in Fiji, and it was still Fiji School of Medicine at
Yeah.
that time. I did 1 year of internship at
Yeah.
CWM Hospital. And in fact, I had moved to Australia.
Okay.
And I didn't really have any plans of returning to Fiji.
Yeah.
But the reason why I actually came back was because this foundation was being formed and they needed
Wow.
some help.
Yeah.
And so I thought, you know what, if I can give back to my country,
Oh, that's so beautiful.
I would.
Yeah.
And that's the reason why I came
Yeah.
back to Fiji,
Oh.
Temesia.
Oh, well, that made me so emotional. That early detection, a lot of our communities, I can literally hear a lot of, from my experience, moms or aunties like, what's wrong? Oh, I was just something. Oh, just, you've been playing too much. You just need to sit down. How do you go with bringing awareness to these communities and families, knowing that their health matters?
I think it's really the education. We need to educate our people.
We do.
That, we have to take our children seriously.
Yeah.
If
That's a good point. Take your children seriously, Fiji.
Yeah, because, if they're telling you, I've got this pain,
Yeah.
or, they're running and playing, they're
Yeah.
getting really short of breath. You look at them, they're not growing well, they're not
They're
gaining weight. They may have like blue lips, blue fingertips.
Yes.
These children may have swelling around the eyes, around their legs, around their tummy.
Oh, wow. Okay.
Or, they can have repeated infections like pneumonia, chest infections.
Whoa.
So I think...
And it really starts from that, right? And then it grows?
So what happens is those kids who have those defects are more prone to have all of this.
Oh, I
because what
see.
happens is a
Okay.
circulation in their, they've got holes or defects in their heart. So the circulatory system is not working the way it needs to. So they're not getting enough oxygen through their lungs, into their brains, into the rest of the body. And so they're going to be symptomatic. Some kids may have not very many symptoms.
Right.
They might have very subtle symptoms.
Yeah.
Some will be very short of breath when they're born. Their oxygen levels will be really low.
Oh, wow.
And those kids will be picked up quite early. But it's the ones that are sort of okay and then later on are having some issues. I think parents and caregivers need to take these children seriously. Take your children for checkups. Like we have a children's heart screening center. We do free screening. We're open Monday to Saturday.
Did you just say free screening?
Yes.
Well,
absolutely free.
To all our amazing viewers, there's free screening for you. We have more right after the break on Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Welcome back to Your Health Matters here on MyTV. I have an amazing guest, Dr. Krupali, who's just shared about the foundation, Sai Prema, and now we've talked about the hospital and that big heart that I'm always wanting to know. How did that come to be? And to hear the story just from Dr. Krupali tonight, it's been amazing. I'd love to continue our conversation about our young children and how do we detect these issues. So thank you so much for sharing more.
So, as I mentioned, we can do free screening in our Children's Heart Screening Center. We screen from Monday to Saturdays. We also do screening in the community. our team go out to the public health centers,
Yes.
we go to schools,
Oh, wow.
villages.
So you're working with the schools, the
Yes,
villages,
villages.
the health medical centers.
Yes, and the maritime region as
Maritime
well.
as
Our
well.
team have been to Yasawas, Lambasa, Bua,
Wow.
everywhere.
So you've
And the
literally
Pacific as well.
Pacific.
Yes.
That's amazing.
Yes.
Going out into these communities, what is your response from the people in the community? Are they coming, or you had mentioned a lot about education for these
Yeah.
communities and stepping out. What's it like providing this when they hear the word free? Do they jump for it, or is it something they're still nervous about?
No, I think they do.
They
I think
do,
there
huh?
are people who are
That's
very
good.
keen because
Yeah.
when you look at the screening, it's not
Yeah.
painful. It's literally,
Right.
it's a scan.
Because everyone that thinks hospital, oh no, I don't want to get an injection.
No.
But it's a scan, right?
It's a
We're going in
scan.
for a free scan.
Yeah, so basically there's a little bit of gel that goes on a probe. The
Yep.
sonographers will, go around the chest. They're going to
Chest.
have a look at the different views. It's
Wow.
not painful. It's
Not
not
at all.
uncomfortable.
Mm.
And it takes only a few minutes.
Wow.
So it's very non-invasive, but you
Yeah.
can pick up, is there a hole in the heart? Or what are the
Wow.
defects? Are there issues with the valves? How's the function of the heart? So a
Yes.
lot of information that you can pick up. And I think the communities are now embracing it
They
because they
are.
realize that there's a great opportunity. It's
It
specialized care. It's very hard to get a heart screening. You need
Yes.
trained personnel to do it. There's often a long waiting list in the
Yeah.
public hospitals as
That's
well.
right.
So we're doing our best to do screening, and we're
You're
almost
filling the gap for these
Yeah.
communities.
we're close to 30,000 screenings so
Oh,
far.
wow.
Yeah, so it's been it's been fantastic, and we've detected a lot of children through that program,
Yes.
and we fed those into the hospital.
Right.
And many of those children have had their free heart surgeries as well in our hospital.
Did you say free heart surgeries?
Yes.
Wow. Sorry, I'm still so caught up with this free scanning. How
Yeah.
old are we talking that children are able to come for these scans?
From as little as babies, zero to 16.
Come right in.
Come right in. In school holidays as well, we
Yes.
screen. Throughout the year we're screening,
Yes.
and we're very active on our Facebook page,
Yes. Okay.
Sai Prema Foundation Fiji, and we often put down where we're going,
Okay.
which
So a
communities
lot
we're
of
going
these
to. Yes.
communities that are watching, they know
Yes.
where to go.
Yes.
That's amazing.
Yes.
These free heart surgeries for these children, a lot of people might not be aware that are watching tonight. From these free scannings, then they're found to maybe have a surgery,
Yes.
and then they come in to support you. And I know we had a conversation. You said you had a child from Samoa. I thought that was really
Yes.
cool.
We
So
do.
providing this service to the Pacific, is this one? I'm not too familiar if there are other services like this, but is Sai Prema Foundation and the Heart Hospital one of
Yeah.
many, or what's it like for us here in the Pacific?
Sure. So these hospitals,
Yes.
doing children's heart surgeries is very different to doing adult surgeries
That's
as well.
a good point to know. Yeah.
And the size of a child's heart is the size of their fist often.
Right.
And we've had babies as little as 1 week who've been
Really?
operated in our hospital.
Wow.
So it's very complex, the surgery that's often done. The children are very little. We have a big team that comes. So we have visiting teams that come from different parts of the world.
Okay.
They volunteer their
Yeah.
time, but we have a lot of logistics and things to organize, a lot of
Yes.
specialized medications,
Yes.
consumables, and things that we as a hospital have to
Yes.
procure, have to organize. And the children that are detected the children who are positive or who have, a congenital heart defect, we actually discuss. We have a meeting,
Yeah.
a virtual meeting initially
Yes.
with the team, and we go through all the children. They look at all the images, the x-rays, the echoes.
So much that goes into
Yes,
it. Yeah.
a lot goes into it. And then when the team come in, 2 days, first 1 to 2 days, they rescreen all the kids and work out who actually they will operate on.
Okay.
And when we built this hospital, Temesia, this hospital really was built for the children of Fiji and the Pacific Islands. It's not easy having a facility that does heart
Doesn't sound
surgeries.
like it. Yeah.
So the closest hospital is the Starship Hospital in Auckland, in New Zealand.
That's a children's hospital.
That's a children's
right?
hospital in New
Wow.
Zealand. And, in New Zealand, they only have one hospital that does this sort of work.
Really.
And our Sanjeevani hospital is the only hospital in Fiji and the Pacific
does
that
the
look
work.
after these children.
Wow.
It's because children are important.
They
Children's hearts matter. And if they were, prior to our hospital opening, some children were able to go to New Zealand, but it cost over
It costs a
$100,000.
lot.
Most parents cannot afford that sort of money.
yeah.
And that's the reason why
You
the
started
foundation decided to build this hospital.
That's so beautiful. I'd love to know more about how parents can be involved at home right now that are watching, and they've probably kind of sense something is up with their child, but they're not too sure. what would you like to share with these moms and dads or carers at home that are watching that they can look out for their children?
Sure. So I would say if they're worried the children are not growing well, if the children are having repeated infections, they're having chest pain, they're getting short of breath, they've got swelling, around the eyes, the legs.
Like
with the little babies, if they're sweating when they're feeding, if you're feeding the baby and they're profusely sweating on their forehead, that's another sign to look out for.
Okay.
And a little baby that's breathing quite fast. So those are the signs. And I'd say if that's happening, I think that they need to take their children to the nearest healthcare provider and get a doctor.
Step 1, go straight there.
Go straight there, get your child assessed. And throughout the country, most of the centers, doctors, nurses all know that they can refer to our hospital. Or if they're worried enough, they can come straight to us. There's no problem. We are very happy for people to just bring their children. Look, don't wait, because you know what? By waiting, you may end up losing your child. And that has happened, Temesia.
Oh, wow.
That has happened many a time. So I think it's important, parents, it's not that complicated.
Right.
You need to seek help, medical attention quickly. So I would suggest that, go to a healthcare provider, come and see us at our screening center, and we can help. We can assist.
And support,
And support.
I really love the interior of your hospital. If you have a chance, get on Facebook and see the foundation and the work they do and how cute the hospital is. It's so adorable. They have like really sensory buttons and things in there. One thing that really also fascinated me was the nutrition bit that the hospital offers. And I think here in the Pacific, we tend to struggle a bit. What's that quote? The Pacific, we live to eat instead of eating to live. So how did you bring in that nutrition concept into the hospital?
So I think with children, when they're recovering from their surgeries, it's important for them to have nutritious food as well. And as a foundation, our principles and values are that you don't harm anybody. So our hospital is a vegetarian facility. So all the meals that we give to the parents, to the children, they're vegetarian. But we work with a dietitian who ensures that they're getting the nutritional content, their protein, the vitamins and minerals, the carbohydrates and the micronutrients,
no
the vegetables.
Processed food.
So we're really working towards that, and that is so important when they're recovering. And for the planet as well. I think it's an important thing. So
I love this holistic approach. You're looking after the heart, to the body, the mind. It's amazing.
And we feed the parents as well.
Oh, you feed the parents as well.
As well as the children. We allow one parent to stay with the child during the surgery. And we have the visiting team that comes, so we feed all the visiting team members, our local staff that are there working as well. So, we got to keep, and the team that come, they're working long hours. They're standing for so many hours. So
like
they need to be fed
there's
well.
Quite a process to
it's a long
scanning
process.
the child's heart.
We've had 363 surgeries so far. And we're having surgery starting very soon on the 24th of April.
Wow.
We have a team
you don't
coming.
have much time.
Yes.
Yeah. Oh, so you're busy planning logistics now.
We're working
Dr.
hard.
Krupali, we're just going to go to a break. Thank you for joining us on Your Health Matters. We'll see you right after this break.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Welcome back to Your Health Matters. I'm your host, Temesia, and we have Dr. Krupali here tonight from the Sai Prema Foundation and the Heart Hospital here in Fiji that serves not just children in Fiji, but everyone in the Pacific. Dr. Krupali, I'm so excited to talk about this next bit because I work in spaces like this as well where we try to, educate our communities. So the workshops and programs and also the blood drive that you do with the hospital and the foundation. So if you don't mind just sharing about the programs that you have, and that the wellness one is really important, I think, that mental health and meditation.
Yes. So we have some educators who have actually moved from New Zealand to Fiji.
Really?
Yeah, and some of them are school teachers as well.
That's
some
so
retired
beautiful,
and some currently teaching
Giving
as well.
their time for children here in Fiji.
So we're running children's values workshops.
Wow.
And we've done them sort of across the Viti Levu and also in Lambasa.
Really?
And we've had very good response. And there have been a lot of children who have attended these workshops. And they're not religious. It's really about values.
That's
love, peace,
Yes.
right conduct, being kind, kind, being caring, being compassionate.
Yeah.
And we can see that it's growing. And we
is.
advertise this on our Facebook page.
Okay, so families out there,
yeah.
please go on their Facebook page and follow and like and stay in the loop so you can find out more about this.
We've had already over 350 children who benefited
that have come
from
through these programs, the workshops.
The workshops. And then we've had meditation workshops as well, sort of throughout Viti level, again in Lambasa, and over 700 participants we've had. And these, they're 1 to 2 hour workshops. Some of them are longer if we've got more time.
They sound so peaceful when you say
they are.
It must be so nice to do this with the community.
It's really good because everybody's stressed these days, Temesia. And we all need to work on our mental health, how we can keep healthy.
Do you feel here in Fiji and the Pacific, do we sometimes neglect the need for that wellness, the mental health support?
Oh, we do. I think we really do. And everywhere in the world, to be honest. But particularly in our communities, I think it's something that we don't really think about. So I think that it's a really great workshop as well, because you learn about basic meditation principles. And you can do those at home. It's free. It's good for you, and you learn techniques. So that's been really fantastic. We've done a bit of teacher training workshop as well.
Oh, that's an exciting one.
Where some of the teachers have, we did a workshop for them, and then now they're doing some Zoom sessions with our educators.
Wow.
And it's a lot of it is incorporating values in there and how that they can become better teachers. So we've done those workshops. We do blood drives across sort of town cities of Viti level, Vanua level. And, you know, when we do heart surgeries, we obviously need a lot of blood. Because many of these children need blood. But we're not just doing this for our hospital and our children, but the fact that we want more people to be able to donate blood and for the blood banks to have enough blood. So we have Be a Hero, Save Lives. That's our tagline.
That is such a cool one. Can you say that again?
Be a hero,
Be a hero,
save lives.
Save lives.
Because, you know, if you donate 1 unit of blood, you can save up to 3 lives. And we've had over 14,000, actually over 14,000 lives have been saved through all the blood drives that we've conducted. And again, we put this on our Facebook page, we share it. So if there's a blood drive happening around you, please participate. You can save a life. You don't have to be a superhero.
You give 1 unit
You can save 3 lives.
3 lives.
Because you separate the components. You can have the platelets, the plasma, the different components. So you can really make a difference. And you don't have to be a superhero or a doctor or a nurse to save lives. You can, by donating,
you can do it.
And your body will regenerate it.
I love this whole community collaboration that you have going. I feel like it's a strong part of the foundation. It's bringing everybody in together, that it's not just the hospital's job or the foundation's job.
Definitely not, you know. It's bringing people together. And if people want to volunteer, there are opportunities as well.
Oh, that's cool.
They can email us on saipremafiji@gmail.com. Or they can write to us on our Facebook page. So we're Sai Prema Foundation Fiji. And we're very active on Facebook as well. They can write to us. If they want to, you know, volunteer with anything, they can write to us, and we'll be happy to have people assist. We're also doing a feeding program.
That's a really important one, because I feel like food is such an important topic here in the Pacific.
That's right. But we also have a lot of people like single mothers or families where there are people who are not able to work or have disabilities. So our team identified that, and we provide packed foods to them. So these are like ration grocery packs. So we've done over 4 million meals, and we're continuing to do this. Through COVID, there were a lot of people who needed help. But even now, there are families who need help and support. So our team's still working and trying to provide this basic nutrition to families who need help.
What's it like working with the Pacific in this sense? You had mentioned that they can contact you through Facebook, and knowing that Facebook is a very strong platform here in the Pacific. When you're working out with like the young child that came from Samoa, what was that opportunity like for that family? Because I feel like it must have really touched their heart that there was support here in the Pacific.
So I think with all these children that come from the Pacific, we're working with the pediatricians and the local doctors there, and we've got in their countries. In some countries, our teams have gone to screen, like Tuvalu and Kiribati and Solomon Islands. Some of the doctors have gone to screen as well, and so they feed into the system. They tell us about these children, and we put them on the list. And I think for the Pacific, it's really been good because the culture, the community, in the sense here in Fiji is similar to what they get in their countries. And so I think they were very grateful that they were able to get free surgery as well. something that would cost so much money,
So much money.
which they cannot afford. So kids from Samoa, Vanuatu, Kiribati, Tuvalu, Solomon Islands, Christmas
Wow.
Island, Papua
Have
New
come
Guinea,
through. Wow.
Samoa, and the
Wow.
list continues.
Continues,
It
yeah.
continues. They're very grateful,
Mm.
and they appreciate that their child was, saved or helped. And I think
Exactly.
that Fiji, being the more developed out of all the Pacific
Pacific.
Islands,
having that service provided
that's right.
is so
And we're
important.
grateful. I have to mention this, Temesia.
Yes,
we're also
please.
grateful to the government
Yes.
for helping us. They're giving us a
Mm.
grant that helps with,
Wow.
some of our operational
Yeah.
costs. But we still have to raise a lot of funds
Yeah.
because to run a hospital,
It doesn't
it's
sound
not
cheap
easy.
at all. Yeah.
And our standards are very high.
High.
We have to make sure, because cardiac surgery
Yes.
is very complex.
Yeah.
And infection risk is a real concern. So we're really particular about that. So
Wow.
we have to continue raising funds as well. So if there are people
It's
who...
non-stop.
It's non-stop.
Yeah. The work continues
So
for you.
exactly. So we
Yeah.
appreciate the government support, but we appreciate support from the community,
community
from
as
the
well.
corporates if they like
Yes.
to donate
To
towards a
donate.
worthy
Yes,
cause, or if they're
please.
individuals who feel, we want to help towards
Yeah.
this cause. We're very happy for them to contact us.
How can they contact you if they would like to support the,
They can,
the hospital and
They can
foundation?
actually come and visit us at the hospital.
Okay, good to
They
know.
can write to us on Sai Prema Fiji@gmail.com.
Okay.
They can write to us on our Facebook page,
Yes.
on Messenger.
Yeah. And
So
just
there's
reach out
Just
and
reach
support.
out and support.
Just talking with you, Dr. Krupali, since we started this conversation, is just like, I've just loved how you've brought in the whole community and bringing everyone together. What is your hopes and dreams for this hospital in Fiji and the Pacific in the years to come?
So in the years to come, Temesia, what we would like is
Yeah.
that we have a local team or a permanent team that's
Okay.
operating on the children. We
Okay.
are working on building local capacity.
Yes.
We've employed some of our own nurses,
Yeah.
technicians, slowly,
Wow.
hopefully doctors as
Yeah.
well. But we're already working on building a team. And the vision for us at the hospital would be that we have a full-time permanent team doing this work. And that
Okay.
no child who has a congenital heart defect
Yes.
or born with a heart
Yes.
issue, dies because
Yeah.
they can't afford it or they have
Yeah.
no opportunity.
Yeah.
So really, that's the vision, to
That's
help
the
as many
vision.
children in Fiji and the Pacific. And we know that our children are our future.
Yeah.
So if you invest in a child, you're investing in that future of that child, and you're helping the whole family.
You are.
Because when you're a child and you're suffering, the whole family suffers.
Suffers, yeah.
So that is our vision, to alleviate the suffering of these parents,
Wow.
the children, and really that we can help as many people as
As
we
many
can.
people as you can. I think it's been really cool to hear about the numbers,
Yes.
because I think it really pushes people out there that there are services available.
Yes.
Dr. Krupali, as we bring this to an end, would it be okay if you could just mention again the free scanning
Yes.
and the free heart surgeries, just for those that might missed it, and how important and crucial it is for them to come in?
So I'd really encourage parents to reach out. We do free heart screening in our Children's Heart Screening Center. So that's the Sanjeevani Children's Heart Screening Center, which is based in Nasese. We also do free heart screening in the public health centers, in schools and villages, in maritime regions as well. So please, if you know that there's screening happening, in your community, please take your child. Don't miss the opportunity. It's free. It's not painful. And you get lots of information. So I really encourage all the parents, and also for the children who have been detected to have a heart condition, don't be afraid to have your child operated, because you're going to give them a new gift of life. Many times these children just need one surgery and they're fixed. But there are some parents who are reluctant. They're not sure if their children should be operated on. And often, it's always a discussion with the team that come. And they only operate if the benefit is greater than the risk.
Wow.
And so I know there are some parents who don't want to have surgery because they're scared or they're worried. But I would say, this is a great opportunity for your child, because if you don't do anything, they're going to lose their life. And that would really be my parting note.
Partake to everyone out there. Dr. Krupali, thank you again for coming in tonight.
Thank you for having me.
Thank you, Dr. Krupali. That's it for us here on Your Health Matters. Join us again next week, right here on My TV.